Hello, this is Dr. Lara Tigler. Welcome to my channel. This channel is meant to provide general medical information. It's not meant to provide specific medical advice. Please do see your primary care provider or your doctor to obtain medical advice that's tailored specifically for your needs. At the end of almost every video, I do provide some spiritual information. If you do not want to stay for that portion of the video, once the medical information portion is finished, I will let you know. And at that point, you can simply click away. But first, please do like and subscribe. Today's topic is narcotics, but we're going to narrow the field and just talk about side effects. So you can see that the topic is narcotic side effects. Common side effects of narcotics. First and foremost, constipation. If you do get prescribed a narcotic, say hydrocodone for an ankle sprain or morphine in the hospital, you should expect constipation. As a matter of course, it's pretty much universally recommended that you take a stool softener with each dose or on the day of that you take the narcotic. Constipation, if untreated or if allowed to progress to become more severe, can cause a host of other problems. So you do want to prevent it. The second thing is sedation. So sedation is a medical state. It does reduce anxiety, but it also reduces awareness. Constipations can cause sleepiness. Now, sleepiness is a physiological state. It can be reversed by stimulation. Narcotics can cause nausea, vomiting. Both of these could be treated with anti-nausea, anti-vomiting medication. Also, dry mouth. Dry mouth is a common side effect from many different medications. Really, for any of these symptoms, you do need to talk to your primary care provider or your doctor and sort out what the cause of these symptoms are. And finally, a common side effect is itching. So narcotics or opioids, they actually induce histamine release, which is obviously not desirable. So for example, those patients who suffer from allergies or people who have family members who suffer from allergies, let's say runny nose or hives or some other manifestation, they know perfectly well that an antihistamine against the histamine is a common treatment. Let's say Benadryl or loratadine or diphenhydramine, which is generic Benadryl, etc. So now you know that opioids or narcotics can actually induce the release of histamine, and that's not at all desirable. So common narcotics that can cause itchiness or itching: Percocet, the generic is oxycodone; morphine; fentanyl. Serious side effects: respiratory depression. And that means slowed or stopped breathing. Obviously, if you take too much narcotics or opioids, you could have a fatal overdose, meaning that you have stopped breathing. It can also cause hypoxia. A serious side effect of narcotic is hypoxia, and that means reduced oxygen in the body related to the fact that the patient's not breathing at the rate that they really should be breathing at. So the narcotic artificially slows the breathing rate down, and then the body has no way to get that oxygen that it sorely needs. There's a whole host of problems from having low oxygen level, hypoxia. So that definitely should be avoided. Okay, the third bullet point here is addiction. I think that's what many of patients worry about, that they'll become addicted. Only a certain portion of patients who take any controlled substance will actually end up becoming addicted to it. But it is something to worry about in general. However, usually it might be patients who have more of an addictive personality or have problems with other addictions. But addiction is a problem because if the patient doesn't get the medication or the substance that their body is addicted to, they could go into withdrawal symptoms upon stopping that substance. And that can be a long list of other problems. The fourth bullet point here, physical dependence. So that means that the patient doesn't have associated behaviors with addiction, but their body is still needing the substance. In this case, we're talking about narcotics. If they don't get that substance, then they could have withdrawal symptoms upon stopping that substance. So, for example, let's say they're taking a narcotic for a certain period of time. You can become physically dependent on a narcotic or other controlled substances rather quickly. So if the patient stops it suddenly, they could have some withdrawal symptoms. Another thing about physical dependence is that, let's say the patient is taking narcotics on a long-term basis, then after some time, it depends on the individual, but their body becomes used to the dose that they've been taking. And to get the same effect, they'll have to have a higher dose. That's a telltale sign that there is a physical dependence, or the body is able to tolerate a higher and higher dose because it's been taking the substance, the person has been taking the substance for a long time. This next bullet point, hyperalgesia, it means increased sensitivity to pain. This is very counterintuitive, but this is one of the reasons I'm doing this video, is so that you understand that taking narcotics is not desirable in the vast majority of cases. It can have a long list of problems and side effects, but this particular bullet point is letting you know that due to the nature of its action on the brain and the spinal column and other receptors in the body actually becomes more sensitive to pain. So once the narcotic runs out, let's say it's hydrocodone, it lasts about 4 to 6 hours. After about 4 to 6 hours, the patient is in more pain. They have a sensitivity to that pain. They perceive it as being in more pain, and they misread it, and they think that they need more narcotic because they have a lot of pain. But it's really just an effect of the medication itself. And as you can imagine, that's a vicious cycle. The next bullet point, confusion, hallucinations, and depression, actual clinical major depression. Okay, low T. How many of you have seen this advertised? Low testosterone. So that's obviously not a desirable situation for a man to have too low of a key hormone in their physiology. And that has a whole host of problems associated with it. But hormone effects could include decreased energy, decreased strength, and decreased sex drive. Okay, risks associated with narcotics that I haven't mentioned yet. Of course, I already mentioned many risks, many problems, but these are two problems that you might not normally think of. Infection, if taken injected. If you inject the narcotic, just the mere act of injecting, making a hole in the skin, possibly introducing bacteria, can increase your risk of having a serious infection. And then this next one, neonatal abstinence syndrome. So you might see that NAS. And this is if the narcotics or opioids are used during pregnancy. So benefits of narcotics, if they have all of these terrible things associated with them, why do we even use narcotics? So narcotics do give significant pain relief, and that's obviously desirable. And so we doctors and providers would use narcotics in very specific situations. After a person has had a surgery, say a knee replacement or a hip replacement, some sort of injury, like I mentioned earlier, an ankle sprain, a significant ankle sprain, trauma of some sort, and I mean physical trauma. And then narcotics are appropriate for cancer-related pain. So there could be a person who has a stage 4 cancer. They have quite a bit of pain associated with it. it's perfectly appropriate to give the person narcotics, quote, long term. If that cancer is they're going to die with that cancer, in other words, then some of the other concerns could be simply managed. Like, for example, the physical dependence, you might just have to increase the dose periodically, or the constipation, make sure they have a stool softener, or the nausea and vomiting, make sure they have a good anti-nausea, anti-vomiting medication. Okay, some strange things about narcotics. Narcotics actually have the benefit of suppressing a cough. So in prescription cough syrup, sometimes, not often at all, but sometimes we'll prescribe a cough syrup. Let's say someone has outpatient pneumonia. We might give a syrup that actually has a narcotic ingredient. It's very rare because we have other prescription cough syrups that don't have narcotics in it that work quite well too, even better than over the counter. And then there's over the counter medications as well. But just so you know, that is something that we can prescribe. And then narcotics can inhibit diarrhea. Not that that's a first line treatment whatsoever, but just so you know, this is a strange thing about it. Um, and then if you think about it, that does make sense, doesn't it? Because it does cause constipation. Okay, and then certain narcotics can treat opioid use disorder caused by narcotics. So that would be methadone or buprenorphine. And so usually a specialized doctor would prescribe that. Someone who's used to prescribing it can be very complicated. Okay, so that's the end of the medical information. If you do not want to stay for the spiritual information, now is the time to click away. But first, please do like and subscribe. So today I'm going to go over the Sermon on the Mount, not in great detail, but just talk about a couple things regarding it. I do encourage you to go to your Bible and read about it. Okay, so just going to go down to this area, key takeaways. And you can Google or AI this for yourself. But inner transformation, focus on your heart, not just rules. Focus on your motivation, not just following some arbitrary rule or even a good rule. You're not following the rules, or hopefully you're not following the rules because they're rules, although that's certainly a good thing to try to follow rules that make things smooth for the community or whatever group you're involved in. But Jesus taught us to focus on our heart and our motivation. So, for example, if you read books that analyze the Sermon on the Mount or even the Sermon on the Plains, on the Plain, you'll notice that they'll say, if you have anger, let's say you're easily prone to anger, that's not benign. You can't just say, well, I didn't act on it. I didn't punch the wall. I didn't murder that person I was so angry at. But what Jesus is trying to say at a deeper level is that if you're exhibiting anger, that's like murder. And I know it's not the act of murder, but it's akin to it. So that you want to have self-control and try to manage your anger and even ideally get rid of it. Of course, it's normal and natural to be angry in certain situations, but I would say that Jesus would say that you want to get over that anger quickly and find the compassion and love for the person that you're dealing with. Remember, Jesus actually said, it was quite radical. He actually said that we're supposed to love our enemies, not just tolerate them, but love them. And that means not being angry at them. Okay. And then another example of a certain attitude that we might have is lust. So let's say you're looking at your phone all the time let's say you're a man and you're looking at your phone all the time at beautiful women, maybe with the pretense to order, pretty lingerie for your wife or something like that. But you're almost addicted to it. Or even let's just go so far as to say pornography, actual content that's not healthy. Um, and then you're lusting just by looking at your phone, or whatever you're choosing to look at and put your attention to. So Jesus would say that that lust that you're exhibiting in a habitual way, that's akin to adultery. And remember, in the Ten Commandments, one of the Ten Commandments was that you should not commit adultery. So I wanted you to be aware of the Sermon on the Mount. It's really an example of Jesus' key teachings, introduction to the Sermon on the Mount. And remember that I did share with you in a few videos that one of my favorite YouTube channels is BibleProject.com. And last year in 2025, they did many videos, many teachings on Sermon on the Mount. And you can actually buy books and read about what the Sermon on the Mount means. This is something that you could do as your own Bible study. Okay, so I wanted to emphasize today inner transformation. And you know me, I'm going to bring this light down. So it's all about inner transformation. That's what Jesus was trying to teach, that the kingdom of heaven is within. Inner transformation. You can be at peace. You can have all that you desire under God, if you go inward. So breathe in. Breathe out through your mouth. And you can focus on the teachings on the Sermon on the Mount. I encourage you to read that in the Bible and elsewhere. See you next time.